Okay, welcome back to Eat to Grow podcast. Today we're talking about PCOS and how to manage it, what it is, all the supplementations that go into it. So, to start off, PCOS is really just a diagnosis where cysts form on the ovaries. And this can affect infertility, it can affect quality of life and hormonal balance and all of these things. And the biggest driving force of that is insulin resistance. There are different types of it, but the most common one that you see is due to insulin resistance because it elevates the testosterone and all these things. And that's really where PCOS comes into play. So some of the symptoms that you may feel when you are experiencing PCOS is irregular or missed periods. You could have excessive hair growth, which is a huge one where you see hair start growing on your face, your chest, anywhere really. Your acne and your oily skin start to pop up. You have a lot of difficulty losing weight, which is huge, which we'll go into that later on. But you also have thinning of the hair, you have infertility, like I said, and fatigue and mood swings. So, Kelly, if you want to deep dive into what PCOS really is biomechanically.
Absolutely. So that's a really great rundown of like signs and symptoms, brief overview of what PCOS is. I wanted to add, so when it comes to the diagnosis criteria of PCOS, there is a Rotterdam criteria. You have to meet 2 out of the 3 criteria in order to be diagnosed. And sometimes somebody can be diagnosed with PCOS without actually having the cyst present on the ovaries, which is so interesting. So although it says polycystic ovarian syndrome, you don't always need cysts. So if you have irregular menstrual cycles or high androgens or a component of insulin resistance, you may be able to meet a criteria and receive the diagnosis. I will also add, I think there is still a big gap in the literature in terms of what PCOS actually is and how to really treat it effectively. I think there's still a lot to learn, especially in, our women's healthcare system when it comes to treating those with PCOS without just, say, defaulting to metformin or a GLP-1 as the primary treatment or a 1,200 calorie diet. And we're going to dive all into that. So with PCOS, there's going to be that increased androgen production. So androgens are going to be your male sex hormones. Females have these too. So your testosterone, which most is commonly associated with, I feel like, males and muscle growth. But when you have these high androgens, that's when you can get those really negative symptoms of like the facial hair growth, and you can have the oily skin. So testosterone is going to drive that sebum production up in your sebaceous glands, and that's going to cause more acne. You're also, unfortunately, in more of an estrogen dominant like state in comparison to your progesterone, which is another female sex hormone essential for pregnancy and the placenta growth. So progesterone, when it's low, you will also experience that estrogen dominance. Therefore, you can experience cystic acne from that angle as well. So you can experience hormonal acne from high testosterone and high estrogen in comparison to progesterone. So that's usually, that's the high androgen production is usually a result of the insulin resistance component. So the interesting thing about PCOS is there is a term called lean PCOS, where somebody may have the progesterone imbalance, they might have high androgens, but they might not actually have the component of the insulin resistance as much. They might have totally normal blood sugars. And so that, again, just kind of highlights there's different types of PCOS. We're going to talk mainly about our typical textbook case where there's weight loss resistance present and insulin resistance present. But I did also want to add, there are various types. There's one called lean PCOS where the insulin resistance isn't the driving force, the higher androgen. So that said, we're also going to see that there's a lowering of the SHBG. So this is your sex hormone binding globulin. And that's a protein that's going to bind to your testosterone and your estrogen. And when you have a lower sex hormone binding globulin, that's going to result in more free testosterone circulating in the blood, therefore worsening the symptoms of the PCOS. We also have an interference with ovulation. So insulin resistance is going to disrupt that normal process where the follicle development happens in the ovaries. And it contributes to this experience called and ovulation. So you can experience a lot of like menstrual cycle symptoms like PMS, really nasty PMS, and not actually ovulate. You can even bleed sometimes and not ovulate. And so that's called an anovulatory cycle. And that's really common for women with PCOS and the irregular menstrual cycles. So we also have elevated luteinizing hormone and follicular stimulating hormone in those with PCOS. So the ratio of the LH to the FSH is high, and that contributes to increased testosterone production. So that also can cause further ovulatory dysfunction as well. And then, as we've been discussing, women with PCOS, they're going to have low progesterone. So the interesting thing is you could be within normal limits within your blood work for your estrogen and your progesterone, but if your ratio to your estrogen and progesterone's off, you can experience all these negative symptoms. So a lot of women will go into the doctor, they'll get these labs done, and maybe they're not meeting all of that Rotterdam criteria very clearly, but maybe they're having symptoms of PCOS, but they don't meet everything of criteria. So it can be really complicated for women kind of navigating this diagnosis, or maybe a misdiagnosis in many cases when you're experiencing that low progesterone. So the low progesterone is something that's going to cause a lot of those negative signs and symptoms. You can experience insomnia as a result of it, really painful cramping. You can experience really light menstrual cycles. So your flow is really light, really short periods. You might be having periods every, 25, 26 days, maybe even a little bit less, or you could go really long between periods. It kind of just depends. But the low progesterone's another driver of those negative sides. So yeah, big component here is the blood sugar management for most women with PCOS. Kate, in terms of like the management, of blood sugar there, what would you recommend for a client?
So a lot of people in today's society are going to say you have to be on a very high caloric deficit. You have to be restricting so much, but that's not true. They're really only focusing on the insulin resistance. They're seeing that you're insulin resistant, but they're not really focusing on that. They're just seeing that you have really difficult weight gain, like weight loss journey. Mm-hmm. And you really want to focus on low glycemic foods. You want to do high in fiber, healthy fats, lean protein, all these things. You want to avoid like the processed sugars and foods that are going to worsen the insulin resistance. But once you figure that out, it's going to be an easier journey to manage this PCOS. The biggest thing that people focus on is just that really, really difficult weight gain. And when people say that you need to do a really low carb, high caloric deficit, all these things, this type of diet is going to harm the thyroid, which is already in shambles at this point. So if you continue to do that, you're just fucking up everything else, and it's just going to make it worse in the long run, which we don't want to do. So I would suggest doing low glycemic foods, whole foods, rich in fiber, all these things, and still keeping that, not doing an entire caloric deficit. Mm-hmm. You can still eat as much as you are wanting to eat. Yeah. And that's really it. You know what I mean? Like, yeah, absolutely. For diet, at least. Exercise, I would say just regular exercise, focusing on strength training, all these things. That's going to improve insulin sensitivity. And the biggest thing that I want to stress, pun intended, stress management. This is going to help so much. It's just if you have chronic stress, it's going to increase your cortisol levels and then further disrupt all the hormone imbalances. But when you manage your stress, it's going to lower all these things. So basically, long story short, take a chill pill, mm-hmm. because it's going to really just not exasperate all of these symptoms. Yeah. You know what I mean? And I think stress has a lot of what's the word I'm looking for? It has a lot to do with like a lot of diagnosis, which is kind of crazy to think about. Like stress is really the number one symptom of like all these things. And once you decrease that stress, it's going to decrease your symptoms for mm-hmm. most diagnoses, not just PCOS.
Absolutely. It's definitely a primary driver in worsening of signs and symptoms of so many conditions, so many chronic health issues. Stress management plays a huge role, because if somebody with PCOS is enduring this really restrictive diet that they're commonly told to follow, that 1,200 calorie rule. I hate that, but that's what doctors will say for management is low carb, 1,200 calorie diet. If you need to do 150 plus minutes exercise a week. And for women with PCOS, they're already in a hormonally imbalanced state. There's usually more inflammation present, especially if there's that component of insulin resistance, right? And so we're driving inflammation further. We're driving stress up. That's going to drive progesterone lower. That's going to worsen the the symptoms for somebody with PCOS because they're already in this estrogen dominant like state and they're already dealing with this inflammation. And so when the body is feeling stressed, feeling inflamed, it's really hard to see that blood sugar come down because in a fight or flight state, blood sugar is going to be released. And that's going to continue to make the issues of, say, weight loss resistance more challenging and blood sugar management more challenging, and then furthering just driving that inflammatory response. So I think for women with PCOS, it's about finding a balance. And I love using intuitive eating practice for my PCOS ladies because number one, a lot of the time, by the time somebody comes to me, they've been told so many times, follow this ketogenic diet or this low carb diet. They've done the yo-yoing. They've probably developed some disordered eating behaviors at this point because of the restrictive dieting behaviors that are promoted as the cure-all for PCOS. And it's so not the case. Women with PCOS can fuel their body properly, but it really just comes down to, well, how are we fueling? Taking the pointers that Kate just gave, low glycemic foods. In terms of if you're going to have a high glycemic food, say like white rice, right? Just make sure you're pairing that with a fat or a protein or some sort of fiber. And that's going to help with slowing the blood sugar. But following those higher fiber foods, making sure that you're creating balanced meals, pairing your carbs with a fat or a protein or a high fiber source will help you with your blood sugar management. Eating every 3-ish hours, so you don't have these big dips and then swings of your blood sugar. And that's going to help you to regulate your hunger cues so much more effectively. And that's going to help you in terms of just like if you do have some sort of intuitive eating goal, you really want to get in tune with your hunger and really nail that. Or if you're trying to maybe work towards just general weight loss goals. I know a lot of women with PCOS, they do want to see themselves lose weight and they're told by their practitioner that's going to be a part of them seeing their condition get better and maybe even fertility goals for some. And so, even as a Hays aligned dietitian, I understand that sometimes people, they want to lose weight. And I think if they want to do that, just go about it in a way that is pursuing healthy lifestyle behavior change and make that the priority. And then whatever happens as a result of that, then let that be. Because I think a lot of positive can happen just from regular exercise, but not overdoing it. Focusing on the way that you're making your meals, getting in enough fiber, regulating the blood sugar, focusing on the stress management piece. All of those things are going to help improve your PCOS management. And those things might lead to some weight loss for some people if they hadn't been doing those things prior. So I think for a lot of women, intuitive eating can be a great approach to nutrition because they're kind of letting go of some of that diet culture that is often pushed upon them. And I find that it stops a lot of that overeating behavior, that binge-like behavior that I see a lot of women with PCOS have and present with. It's a restrictive and binge-like. And then, if someone's dealing with those eating behaviors, they go to the doctor and maybe their weight was up a couple pounds because they're trying to manage their PCOS and they're having difficulty, but then they're told, go back on, this low cal diet or try a GLP-1. It's going to ruin their psyche. And so those are the women that I work with. And that's the lens that I practice through and what my experience has been. And I think I've seen a lot of women be able to eat way more food than they thought with PCOS and manage the condition really well. So I just wanted to stress that because it's horrible to see. And it's almost like a bias towards PCOS. It's like restrictive dieting, GLP-1s, metformin, and do tons of cardio. And that's what they're told. And it's you can strength train too. And that's going to benefit you so much with your insulin sensitivity because it's going to help to increase your AMPK and that helps with your insulin sensitivity. And so if you're doing that regularly in addition to cardio, then you're going to get double the benefit. But I think it's so commonly pushed like a diet culture approach for women with PCOS for sure.
Absolutely. I just want to add, I think everyone is so focused on when you're having so much difficulty losing weight that you're just focused on losing weight. Instead, you should just really focus on the deeper rooted problem, which is the insulin sensitivity. So when you focus on that, when you get to the deeper problem, you're going to fix all the things above it.
Yeah.
So again, with the Hays approach, it's you have to fix the health part of it and not focus on what you're looking like and what you think you need to be doing and all of these things. And I also think that intuitive eating is almost like the new age, I don't want to say new age, but how people are always saying oh, keto diet's going to fix it. This is going to fix it. Low carb, low calorie foods or diet.
Yeah.
The intuitive eating approach is way more aligned and makes way more sense to have PCOS clients on that.
It does,
And
because
it just makes so much sense. No, it's okay. Go
yeah,
ahead.
I'm just so excited. I'm like, yes, I feel like we're like at my house, like on the couch talking right now. And I'm like, I think, with that, the intuitive eating is the best approach long term, because you can't stick to this low calorie diet long term. Maybe 6 months, maybe
It's
a
a
year,
win-win.
but it's not a lifestyle behavior change, because after a period of restriction like that, it is so common to see those binge-like behaviors come up. And then,
Right.
that binge eating can drive worsening of the insulin resistance, worsen the stress, worsen digestion. And so, yeah, I'm just so with you. Like, the intuitive eating just seems to be the best long-term for most people with PCOS.
Absolutely. It's a win-win situation, because it's so aligned with what needs to happen, and you're pairing, say, like a high glycemic, but you still want to eat that. And that may be in your macros. If you're doing like a low calorie, you have white rice, but is that actually helping in that setting? If you do it within a intuitive eating setting and you're pairing it with like chicken or a healthy fat like olive oil or something like that, it's so much more aligned. Like, you can have the same foods, it's the way you're eating it, the when you're eating it, all of these things. So it focuses more on insulin sensitivity than it does, oh, I can't eat that many things in the other diet.
Mm-hmm. Yeah, instead of like, what do I need to take away from my diet? It's like, how can I just do things and change my diet in a way
How can I move it around?
Yes.
In a way that is going to still align with whatever, however I'm going to fix this.
Yeah. And I think it sounds so simple, and it can actually be much harder to do it in this approach, because I find that like finding balance for people is usually harder than the extreme. Like, it's easier to just go no carbs for some people.
Easier for someone to tell you just don't eat these foods than it is, oh, why don't you think about it? Like, people don't want to think. They want to just be told what to do.
Sure.
And that's another, not to go into intuitive eating. I know this is PCOS podcast, but
no, it's great.
It's harder for people to let their mind choose what they're eating.
Mm-hmm.
Instead of having someone be like, okay, you're going to eat this, this, and this. And they'd be like, okay. But unfortunately, that's just going to damage them so much further.
Oh,
which for a time, you can do macros, you can do that, but it's for a specific goal. And then as long as you're building back to being able to learn from that and know, okay, I can eat this. This is healthy. I can do this. I'm making healthy choices for myself. That's the whole thing. And all these diets, like the keto diet, we all know I don't like that one.
Yeah.
The keto diet, just even in general, macro tracking is going to be not sustainable. It's not sustainable. And intuitive eating for PCOS is so much more sustainable than a keto diet.
Yep.
And it's going to be able to like guide you into not having those restrictive mindset, that like the restrictive mindset. And I can't stress it. It's just so much better than what doctors are going to tell you right now.
Yes.
Just because people aren't trained in it. People aren't learning. It's a new thing. They don't want to know what a new thing is. They want to go by whatever that was working for them, but it's not really working. They're not focused on like the mental part of it. They're never focused on the mental part of it.
Yeah. Yes. To your point of having to make a decision of what to eat and like having to think about it, it is harder. And what's interesting, and people will say this, like my clients will say this, like, you're teaching me how to eat for the first time in my life. And it's a really interesting thing to hear. And it's so true. And if anybody listening to this has gone through their own intuitive eating journey, that might really resonate. Like, you're learning how to eat and feed yourself for the first time in a way that is really holistic. And you're not relying on like mom and dad plating your food, growing up in the household, or maybe, following some sort of meal plan or set of macronutrients, or, whatever trendy diet might have been. And like a lot of people that I work with, they've had that history of like not really having to make the decision about food, someone else making the decision about food for them. And it's honestly hard when you start making your own decisions about food. And that's where that decision fatigue comes in. Like, am I doing the right thing, or am I eating too much? Am I not eating enough? And so like, I think what intuitive eating gives you is it gives you a lifelong skill, because we're going to have to eat for the rest of our life. And your relationship with food is a relationship you're going to have for the rest of your life. And I think for women with PCOS, there is I would add like almost like a healthcare bias, in a sense that every person with PCOS needs to be on a restrictive diet, have these, I would say not such great protocols given to them and expected to adhere as it's their only option, and it's not their only option. And I just want to stress that so much. You can do a lot of good with your blood sugar management with regular meal timing, balanced meals, getting in your fruits and vegetables, eating your grains if you tolerate those well and you're not celiac or non-gluten sensitivity. So I think honing in on what can I add to my diet to fuel my body and help my condition. And some things that I commonly will recommend for my PCOS people to really focus on is like those heart healthy fats, because those with PCOS are also at greater risk for cardiovascular disease as well. When you have that high blood sugar, things get sticky in the arteries. And so the LDL cholesterol kind of builds up. That's your bad cholesterol. And we can oftentimes see that those with PCOS will have poor lipid panels as well. So focusing on heart healthy fats, like your monounsaturated fats, like avocados, avocado oil, olive oil. I also would strongly recommend focusing on your omega-3s, your polyunsaturated fats from your walnuts, your chia seeds, your pumpkin seeds, your ground flax seeds. And if you like salmon, that's great. And if you don't eat a lot of, say, like fresh fish, such as the salmon fatty fish, you may want to consider a fish oil supplement or an algae oil supplement if you're vegan, or if you just prefer that, because you want to have the DHA and EPA bioavailability from those omega-3s to make sure you're getting enough. We don't have the same bioavailability from the plant-based omega-3s, so like the walnuts, the chia seed, the flax, but it's still really good to eat, and you should, and still like gravitate towards those sources. They're still anti-inflammatory, but yeah. So those are important, focusing on the heart health piece. And I think, another thing is focusing on your antioxidants. So like the fruits and veggies, but if you can go for blueberries, I'd strongly recommend it. The anthocyanin in there is amazing for you. Raspberries has the polyphenols, which is really beneficial, another antioxidant. Antioxidants are going to be beneficial for those with PCOS to be anti-inflammatory, fight off free radicals, things of that nature. So getting in your fruits and veg. I also love promoting like broccoli and Brussels sprouts, cauliflower, kale for people with PCOS, as it helps support that healthy estrogen metabolism due to the DIM content. And I will say, I actually did a research paper in school about DIM once. It was like part of like my functional food project. And DIM really does do what it says it does. Like, so if you eat those, and you don't even need a supplement, you can just eat a lot of the broccoli and the Brussels sprouts and kale, and you can receive a ton of benefit from that. So big fan of those veggies for those with PCOS. Yeah. Anything you want to add there, Kate?
No, I think you hit all the point. I was gonna also say the DIM and the broccoli and all of these things, because that it's just going to, it's crazy when you think about it, that like food actually like has these benefits, and it can affect not just being full or like the way you're eating. It's actually having an effect on like hormones and things that are like going on in your body. It's actually going to like help you. Yeah. Which I know broccoli is a huge like, oh, I don't like broccoli. Like, it's okay. Like broccoli's good. I like broccoli.
I love broccoli.
So, yeah. It's like, I was also, little story, I was always the kid that like loved vegetables and fruit.
Really?
Like, I just wanted all of them. Oh my God, yeah. Funny. I was a very adventurous kid. So I was eating like swordfish at the age of 5. Yeah. Like, I wanted to try everything. And now knowing like what they actually do, I'm like, oh, glad I was not like a picky eater when I was little. I'm glad that like I actually like tried these foods. I'm like, okay, now I know what they do. Now I can eat them because I've already had them and I know I like them.
Right. No, that's nice. That's probably nice for your parents too, to not have a picky eater. I was the opposite. I was like the pickiest kid in the freaking world.
Ashley wouldn't eat a lot. Yeah. She does now. She's so much better. She like eats sushi now, and like
for her.
Me and my dad were always the like, oh, let's get sushi. Oh, Kate, try this. And I'd immediately eat it and be like, oh, that's good. But Ashley would be like, nope, all set.
Yeah. No, that's me. I'm like her. I'm more like her for sure. But I've gotten better. Yeah. No, I'm always like jealous of people.
Sorry, what did you say?
I said, I'm always jealous of people that like sushi, because it looks like such a fun like dining experience, but I'm like, not for me.
It is an experience. You're like so right.
Yeah.
Speaking of that, I had salmon. Fun fact, I don't really like salmon. Like, I think it's fishy. I don't really
Everybody
like it.
says that. Everybody says it's fishy.
Yeah. It's a different fishy. Like something like haddock or a white fish like cod, sea bass, all these things, they're not fishy whatsoever. It just tastes like meat. It doesn't, I'm not going to say it tastes like chicken, like how people always like, oh, it tastes like chicken. It doesn't taste like chicken.
Yeah.
It just it has a different
She's not
taste.
gonna lie to you.
I'm not gonna lie, it doesn't taste like chicken.
That's good.
But salmon is just more of like it tastes like the ocean. Like it tastes like what the ocean smells like.
Exactly like the type
And
of fish I wouldn't want.
exactly. Yeah, like you probably wouldn't like it.
Yeah.
But I ate it yesterday and it had like this whiskey glaze on it or something, and it was
Ooh,
delicious. I ate it
really?
and I was like, wow, I'm going in for another bite. I was like, wow, look at me.
Nice.
But the one thing I don't like
Mm.
is I don't like raw salmon. I don't like salmon sushi.
No.
I'll eat it if it's like together in like a whole roll. Like if it has
Yeah.
tuna, I like tuna.
You do?
I like
Okay.
raw. I don't like tuna fish.
Yeah.
I like raw.
Okay.
But
That's interesting.
very
Yeah.
interesting. It's a different taste.
Yeah.
But enough with that. I'm getting my omega-3s in now.
Yes, we love to start getting in our omegas. I know, and that's another thing. I'm like, oh, I wish I liked salmon because I would totally like leverage the nutrition knowledge there and be like, yes, 3 times a week, amazing. So if you do like salmon, please eat it for us because we don't really like it, but it's great for you. So yeah.
No, definitely.
Another thing for PCOS nutritionally, one of the really important things, hydration. Just make sure you stay well hydrated. That'll help your blood sugar. Yeah.
As I'm drinking coffee. Don't worry. Yeah. I drink water. Don't worry.
Yeah. I recommend usually like 90 to 130 ounces for most of my clients, but your fluid intake definitely varies depending on your level of activity and your sodium consumption. So just make sure that you're getting in enough sodium at your meals and things if you're going to have a higher fluid intake. But if you don't get enough water and you're dehydrated, the glucose in your blood becomes more concentrated, and that can lead to further kind of higher blood sugar readings for you. So stay well hydrated, and that'll be helpful.
Exactly. I wanted to get into some of the supplementation that we could do for PCOS. So one of the biggest ones is like progesterone or chasteberry. Progesterone is going to regulate your periods. It's going to balance out estrogen. It's really like the thing that's getting low when you have PCOS.
Mm-hmm.
And that and chasteberry, which is also a similar thing, it aids in PMS symptoms, helps with progesterone, all these things. Both of these are taken during the luteal phase. The luteal phase is 12 days before your period. When you take these 12 days out and then stopping when you get your period. These are going to aid in like all these symptoms, the cramps, what you're feeling, that it's just really going to aid in all these symptoms. Another one is berberine, HCl, and inositol. So we'll have Kelly talk about the berberine HCl, but the inositol for PCOS and insulin resistance, many people experience, obviously, insulin resistance with PCOS. So you can supplement with the inositol, especially a combination with myoinositol and D-chiroinositol. It's been shown to improve the insulin sensitivity. And then like also all these other things, regulate the menstrual cycle, support ovulation, and it's a more natural approach to PCOS. And all these things like really also promote fertility, which is a big thing for PCOS because you may experience infertility with PCOS, which is awful. And that's like so sad that like you have to have that diagnosis. And I know that's like really when people get a diagnosis of endometriosis and stuff like this, like PCOS, like that's really hard hitting on the mental. That you hear, oh, you may experience infertility. Like that's a really hard diagnosis to get. Yeah.
And I will add, there are options in terms of like infertility treatments, IVF. Another piece is if you're managing your PCOS condition well, it can help a ton with the fertility. So
absolutely.
I've seen,
yes, it's not a death sentence. Let me just rephrase that. It's not a death sentence. I know that sounded like it was, but it's not.
No. I think it's so important to like validate how hard hearing something like that is, because if you really want to start a family one day and knowing that might be a challenging route for you, it's a hard thing to process when you really want that baby. So like it is really hard. And I've worked with women who've had miscarriages that have had PCOS, but I will also add, I've seen women with PCOS get pregnant and carry babies and deliver them into the world. And so I think there is totally a way for women to meet their fertility goals, but it might be more of a challenge, it is hard. It is absolutely hard. But the berberine, so like I've been seeing all over TikTok that people are referring to berberine as nature's Ozempic. And I just wanted to say the way that it works is not in the same way that Ozempic does. So a GLP-1 is going to work very different than the berberine. But berberine is something that I have used in clients with insulin resistance, and it does work very effectively. I actually used to take it at a time where I was dealing with some higher blood sugar readings back in my bodybuilding days, and it did work effectively for me at that time. So even if you don't have PCOS, but maybe you have a relative or yourself and you have type 2 diabetes and you're not taking any sort of like metformin, GLP-1 or insulin, and you want to try to manage your blood sugar with the help of some over-the-counter supplementation, this might be an option that you want to explore. I would just caution you to not go too high in a dosage because it can cause GI distress if you do. And it's not super fun. It's like nausea, sometimes diarrhea, sometimes constipation, sometimes you get all three. But typically with berberine, how it works, it increases your insulin sensitivity in the way that your cells uptake glucose. And then it helps to activate AMPK, which is something that's also going to be further activated by your strength training. So as I kind of mentioned that earlier, my strength training is so important, which is kind of like this master switch, I guess, of kind of that uptake of glucose into your cells. And it helps to reduce the glucose production in your liver. So if you've ever heard of metformin, metformin works by basically shunting that hepatic gluconeogenesis. So like the production of glucose in the liver. So it stops that. So that can help reduce blood sugar for people. So berberine can kind of work similarly to metformin in that light. And I do like metformin when it's for the right person, because I think it can be very helpful in managing the blood sugar symptoms, and it can be good for the GI, the gut microbiome. But reducing the glucose production in the liver, as we said, very similar to metformin, and then improving the gut health. So it is antimicrobial and anti-inflammatory. So berberine, when it's not in too high of a dose, can actually be beneficial for the flora of the gut, which we hear all the time how important the gut is, just general health and insulin sensitivity as well. So that's kind of like the really special, I would say, subs that we would commonly recommend. We have more that we're going to dive into, but we're going to have this wonderful little freebie for you guys, for those that are listening to the pod. If you want to get access to the full PCOS supplementation guide, you can DM us and be on the lookout in our broadcast channel for the little freebie there. So we'll drive you guys there for the remainder, or we'd be here for like 2 hours diving into more supplementation.
Right.
But those are like the big key players. And then of course, like your fish oil. So I say that's important for everybody. I just omega-3s, you want to make sure you're getting in your omega-3s. I would recommend a multivitamin for most women, just to ensure that they're getting enough iron more than anything, because I find that a lot of women, that they don't typically get enough iron through their diet. So that can be great to have a multivitamin.
Especially during the menstrual cycle, you're going to lose, when you're thinking you're losing blood is iron. So
yes,
that's also another thing why you're craving red meat, because red meat has iron in it. So that's why your body's telling you it wants iron, because it's losing iron. So that's a fun little like fun fact. And you're like, oh, why am I? It's like when you're craving sweets during your period. It's like same thing. Why are you craving a huge steak right now?
Yeah. No, I think a lot of women don't usually eat, well, some women do. I shouldn't say that. Some women do. And I've worked with women that eat actually a ton of their red meat. But I know that girls, like a lot of women, like pastas and things, and they maybe don't even get a whole lot of protein. I know like the population that we kind of work with, we promote high protein, and I would promote high protein for most people. But that said, you can be low on that. So I love a multivitamin, covers your bases, just keeps you covered. And I think when it comes to additional supplementation to think about, it's like that stress management supplementation, and we'll have some of that in the freebie guide there. I also wanted to touch base on birth control as a form of management with PCOS, and kind of give my 2 cents there. I feel like everybody's different in terms of what their right choice is for them, but I think that birth control is more of a Band-Aid for those with PCOS than it is a real treatment, because when you're on birth control, you're taking in these exogenous hormones, and that's going to stunt that ovulatory process. So you're going to be down regulating your sex hormone production endogenously, because you're taking in these hormones exogenously. And when you do that, it can create further imbalances. So like, for women with PCOS, they might have irregular periods, but when they go on birth control, they might have that withdrawal bleed every 4 weeks, but you're not actually ovulating. You're not actually working to balance out your progesterone and like potentially manage your condition and make it better through those lifestyle factors that we've chatted about today, but rather you take, yeah. And so that's essentially like, if you ever want to come off of the birth control, like if you do have fertility goals, it kind of just delays that process because you're going to have to go through a post-birth control, time frame where you're working to upregulate your endogenous hormones and kind of just prolongs that process. And so like, I understand for women with PCOS, like living with that discomfort might be like, if you're dealing with the hair growth, you're dealing with those things and the birth control helps to reduce that. I can understand why you would want to take that. Let me just say that I understand why that's probably first route of treatment. And like your doctor is going to give you as your route of treatment. But I think in terms of like fixing the root issue, fixing the root cause, I don't think it does that. And so I obviously, when working with somebody with PCOS, I want to empower them to make a decision that feels good for them, but it is not my first recommended route to use birth control.
Exactly. Totally agree. I think it's completely a Band-Aid, and understandably, if you want to fix those like underlying symptoms that are like very to the surface and the hair and like it all ties back to like the mental, like you're a woman in today's society, you don't want hair on your face. And yeah, if birth control is going to fix that immediately, then, and you're like, okay, that is my biggest problem, I want that fixed, understandable. But once you come off that and that hair comes back, then you have to go through a whole phase when you could have just started with this and then gone through it instead of just delaying it. It's really just delayed, but I want to completely agree with you. Understandably, if you want to go on that is your biggest problem, you want to fix that right now, then okay, then that is your decision. I'm never going to tell you, no, you can't do that, you shouldn't do that, like all this. Right. But I do completely agree, it's a Band-Aid.
Yeah. Yeah.
And I think that's like a really hard realization that people have to come to, that like there are Band-Aids in today's society, like in healthcare and all these things. And your doctor may say like, no, this is going to fix it, blah, blah, blah. But they're not really actually telling you the deeper level of it and what's actually going on. And I think that's kind of like why we're here. We want to tell you what the deeper root of it is and how to get there and fix that instead of just fixing the surface level of it.
Absolutely. And I think your point that healthcare doesn't do the greatest job sometimes explaining to women what their bodies are actually doing when they take this. Like what's changing about my hormonal production. Like most women have no idea. Most women have no idea. They might have like somewhat of like a sense, but they don't really understand like, okay, well, when and if I want to come off this birth control and I do want to start a family, is that going to be much harder for me? Like, could I have maybe been a little bit ahead if I had maybe foregone this route of management and, maybe got my progesterone in a better spot. Maybe I got my blood sugar in a better spot. I was doing exercise that like worked with where my body needed me to be and like figured out the lifestyle factors, maybe managed it, maybe felt great. And like, just again, getting to root cause. And if anything, to just empower you to like make an informed decision. I work with women that are on birth control as part of their PCOS management. I would never tell somebody that they cannot do that or it's like the worst idea in the world. Like that is totally their choice. And everybody's PCOS is different. Some women have it really, really, really intensely. Some women, they have a more manageable form of the PCOS condition. So like, I understand, but I would just encourage you to, go in to your appointments informed as best you can and be an advocate for yourself. If you're not happy with how your condition's being managed, speak up for yourself. It's really important to do so because you deserve the healthcare that you deserve and need in that sense. And I think most practitioners, they're all coming from a great place. And I think a lot of the training within our conventional medicine is just, it's a little behind. We have some really great doctors. We know some really great stuff and we have great practitioners. I just think in terms of women's health, we are lacking and we're not maybe doing as best we could in that sense. I think there should just be other options for women with PCOS than what they're commonly told as their treatment plan. And that should be common knowledge. It shouldn't just be, some people, some dietitians or some health coaches or some people that are like promoting. Like that should be a way of like, let's talk about the lifestyle things first. Yeah. And these things that kind of get to the root cause. So